Good afternoon, everyone. Thanks for joining. My name is Leslie Dock. I'm the founder and chair of Protect Our Care. And today we're here to talk about the issue of drug pricing and particularly the need to lower drug prices through the passage of the Lower Drug Costs Act now, also known as H.R. 3. We're joined today by Representative Jan Schakowsky, who's the Senior Chief Deputy Whip of the House, member of the Budget Committee and of the House Energy and Commerce Committee, two committees that together will play an important role as Congress likely uses a budget reconciliation process to make the changes and improvements for America that we need, including reducing the cost of drugs. She's been a leader on healthcare since the first day she walked into the House of Representatives in 1998 and has been one of the most steadfast and important champions of healthcare every day since then. So thank you. Richard Frank is the Margaret Morris Professor of Health Economics at Harvard Medical School. He's got a distinguished career in academia, but also a distinguished career as a public servant in government. His last post as the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services, where I had the opportunity to watch his work for 2 years and evaluate and see the contribution that he's made to making America a healthier place. So thank you, Richard. His research focuses on drugs, drug pricing, the Medicare Trust Fund, mental health, and a number of other critical issues. Today is week 2 of Protect Our Care's RX Summer, our national campaign to lower drug prices, which includes paid advertising, grassroots events, a bus tour through America, all to raise people's voices about the need to move forward. And before I turn it over to Representative Schakowsky, let me just say a few introductory words. Americans pay nearly 3 times as much for prescription drugs as people do in other countries, a fact that the public simply can't understand. In January 2021, in the middle of this pandemic, drug makers hiked the price of nearly 1,000 drugs, basically because they could. You know, something like a vial of insulin, which costs $4 to make, costs the American public hundreds of dollars to buy. And research has shown that drug company profits are nearly 3 times the average of for other companies in the S&P 500. So who profits from this? Not patients, because 1 in 5 patients can't afford to take the drugs they need to keep them alive. Drug companies would have you believe that higher profits correspond with innovation and breakthrough drugs, but that's simply not true. When the companies got billions of dollars in tax breaks from the Republican Trump tax bill a few years ago, they didn't put that into R&D. They put it into stock buybacks and dividends and executive salaries. You don't have to look any further for an example of farmers' greed than this week's announcement of a new drug from Biogen. We all want drugs that will help address Alzheimer's, a horrible disease, both for the people who have it and for families who have to care for people they love. But no drug is useful if people can't afford to take it. Biogen, for no reason except probably that they could, price this drug at $56,000, which is more than twice the median income of a Medicare beneficiary, and about 6 times more than the leading experts on what a drug is worth in terms of its clinical effect said it should be priced at. And here's what the Alzheimer's Association said, as everyone knows, the country's largest and most effective voice for Alzheimer's patients. They said, quote, "This price is simply unacceptable. For many, this price will pose an insurmountable barrier to access," end quote. The Lower Drug Costs Now Act would give Medicare the power to negotiate, the only tool that can succeed against the power and money of the drug industry. It would stop drug companies from raising prices on existing drugs more than the cost of inflation. It would limit launch prices when appropriate, and it would allow the Medicare to use its power to help represent the customer, the people, in this transaction. Over 85% of the American people, whether they be Democrats, Republicans, or independents, support this measure. The Democratic House is poised to move forward. The Senate is hard at work, and a Democratic president has urged them to go forward. It's time for Congress to stop listening to farmers' money and instead listen to their constituents. So thank you, and if I can, I'll turn it now over to Congresswoman Schakowsky. Thank you so much.
Well, thank you so much. I really appreciate the mobilization of people to fight back, because the cost of drugs is universally a problem for all people. This is not a partisan issue, maybe in the Congress of the United States, but certainly not among the public. And I just want to say that as we meet right now, as we speak right now, there are people who are in critical need of the drugs that they can't afford right now. People die because they cannot get the drugs. And we saw when the cost of insulin went up, we even have the names of people that were trying to make it by cutting back on their insulin and died. We know who they were. And this is unacceptable. And the American people, when they hear that they are paying 3 times as much as people around the world on average are paying for their prescription drugs, they are furious. We know from polling that's been done that 90% of Republicans want to see Medicare negotiate for lower drug prices, not just for Medicare patients, but for everyone. We know that 96% of Democrats and 91% of independents also are in favor of that legislation that you talked about. HR 3, we call it the Elijah E. Cummings Lower Drug Costs Now Act. It's been reintroduced in the Congress right now, and we need now to mobilize people to say to Big Pharma, no, we are not going to die rather than get the drugs that we at a price that we can afford, because that is absolutely, as I said, what is happening right now. So Big Pharma, what's their claim? They claim that they are spending all this money on research and development. But the fact of the matter is that actually the price is not set based on how much things cost. They are set on how much they want to pay for executive salaries, to make more profits. And you heard already what the extent of these profits are. And so, because we have the American people who are behind us, we need to get this legislation passed. And if we have to do it, not in a bipartisan way, do it through reconciliation, then that is how we are going to do that. When it comes to drug prices, we know that the American people are spending money in order to do the research and development that the drug companies say they are spending so much money on. We know that Moderna and other vaccines that have been produced have been, because, you know, when Anthony Fauci got his vaccine, he called it the NIH vaccine, because it has been the federal government, the taxpayers, that have actually done so much of that work in order to produce these drugs. There's hardly a drug on the market that work hasn't been done thanks to the taxpayers, and that they claim is what they need to recover because of all this R&D. They spend more on advertising than they ever do on research and development. And let me just end my remarks with this. We are not going to be free of this virus. We are always at risk wherever the virus is flourishing. And so we believe, and now the President of the United States has said, that there ought to be a halt for a period of time of the intellectual property rights of the pharmaceutical companies, in order to make sure that we get the rest of the world vaccinated and that they have the right to be able to produce these pharmaceuticals on their own. So it's the greed right now of the pharmaceutical industry that is really preventing us to be able to crush the virus all around the world, because to them, the profits that they get because of their intellectual property rights are more important than making sure that we are able to bring the vaccines to everyone around the world. That's the extent to which they are willing to go. This is one of the most profitable, I think the most profitable industry that there is. And they are making money at the expense of the American people, their lives, their futures. And we have to pass legislation that will bring down the cost of prescription drugs now. I yield back.
Thank you so much, and for all your work. I have a question, but I'm going to wait till later to ask it. I'll make sure I give Richard a chance to speak his piece and talk about the research that he's been doing and the work that he's been doing that looks very carefully at the relationship between innovation and prices when it comes to drugs. Dr. Frank, and you're on mute.
Thanks, Leslie. I'm going to start really by building on a point that Congresswoman Schakowsky made, which is really a sort of fundamental misunderstanding out there that, in fact, negotiation and government can play a positive role in promoting innovation in this country. And I think the Congresswoman's example of the vaccine is like Exhibit A in that making that point. And you know, we have a lot of evidence that this market needs some help in terms of prioritizing innovations. There are many drugs out there that come onto the market every year and offer very few, if any, therapeutic benefits. I've recently done some research where we showed that about 40% of the drugs that come on the market offer few, if any, new health benefits to American consumers, yet they fetch a fairly substantial price. There's another 40% that offer some real improvements, and those are important, but they don't offer a fundamentally different approach to pricing than the ones that offer relatively few benefits. And some we just don't know. And like the new Alzheimer's drugs, Aduhelm highlights the point. There we have a drug that addresses a dread disease, but remains very uncertain how much it's going to contribute to the well-being and functioning of most people that take it. And the cost is $56,000, as Leslie mentioned. And this highlights the disconnect between prices and the value of treatments. Now, HR 3 really can be used and is used in its latest incarnation to promote innovation in a variety of ways. First of all, there's about $20 billion in R&D on top of the $8 billion that was recently put in through the American Rescue Plan Act. And the negotiating framework that is being put forth in the legislation really suggests that the Secretary will have guidance that will require the Secretary to include concepts of innovation, effectiveness, and cost effectiveness in deciding their stance with regard to price negotiations. And so there are tremendous opportunities in the legislation to make direct investments into the most robust sources of innovation in this country, which are the small to medium-sized pharmaceutical and biotech companies, along with continued promotion of the dynamic research that goes on at NIH. I'll stop there and listen for questions.
Great, thank you, Richard. And folks should raise their hand, and then my colleague Jason will start calling for questions. But to reiterate what Richard said and what the Congresswoman said, the current system provides incentives for outrageous prices. It doesn't really provide incentives for innovation, because we know that the drug companies choose to use their profits to pay back shareholders and themselves, and that they can get away with charging outrageous amounts for drugs that really either aren't proven to work or only have a small incremental increase. Whereas HR 3, not only will it make drugs affordable so that people can actually take them, which is the only thing that matters, because a drug that people can't afford to take that has no meaning for folks. And also, actually, innovation, as Richard said, is a positive force for innovation, because it allows the government, Medicare, to use its power to create incentives for the drugs that will really make a difference and really move the industry towards investing where it matters, not where it believes it could just make the most money. So let me turn it over to Jason to see, take some questions from the folks on the call.
Yeah, folks, if you just want to use the raise hand feature, that'll let us know you have a question, and then we'll call on you and ask you to unmute. The first question is going to come from Jesse Hellman at Modern Healthcare. Jesse, you should be able to speak now.
Hi, thanks for doing this. For the Congresswoman, I was wondering, how are you working to convince some of your Democratic colleagues who have expressed concerns about HR 3? Do you think that this is something that Congress is going to be able to do this year?
There we go. I feel confident that that we will be able to have the votes, despite the efforts of the of Big Pharma, who of course does have more than any other industry, spends more on lobbying the Congress and actually the administration as well. They have certainly a lot of money to do that. But the popularity and the bipartisan support, when you ask what is the top issue that you and your family face, it's healthcare. And if you probe just a little bit further, it's the cost of prescription drugs. That's a #1 issue. And I believe that we're going to be able to have the votes in the House of Representatives, and then the challenge will be in the Senate. But if we go by reconciliation, I think we have a real shot at doing that. So I'm optimistic that we're going to be able to move this legislation as the #1 concern of families in the United States. HR, by the way, this legislation has passed the House in the last Congress, and I believe that we're going to be able to do it in the House in this Congress and move it forward to the Senate.
Yeah, I want to second those remarks. I mean, we have incredible champions in the House, like Representative Schakowsky, starting with the Speaker, who's repeatedly said that this is one of her top priorities. And I think we've seen that betting against the smarts of the Speaker, not to mention her work ethic, is probably not the right political side of the coin to take. But it's really because this is an issue that voters really care about, because it's both a health issue, it's a matter of life and death, but it's a huge issue of financial stress. And people who have to, who know they need to take a drug to stay alive but can't afford it, you can only imagine how that rips apart your day-to-day life. And Pharma has a lot of money. They've broken the records already this year for what they spend in a quarter. But in the end, I think the ire of the voters against those who vote no on a bill like this will be far more dangerous than any bit of pharma money could be. Any other questions, Jason?
Yeah, for the next question, we're going to go to Alice Olstein at Politico. You should be ready to speak. You should be able to speak now.
Thank you so much for holding the call. Similarly, I wanted to ask if you had heard that a markup will happen soon, or how will we see this advance in the House? Is there still an attempt to attach it to a broader infrastructure package, or move it on its own?
Oh, I don't see it as its own. I see that it will be part of a, I think the most likely prospect for this legislation would be part of a reconciliation bill that has several parts. And I think it will be really a very, very popular piece of that. If we could possibly get enough bipartisan support, and enough means at least 10 Republicans that would support it, we could move it on its own. And I think if they were smart, as Leslie said earlier, to vote with their constituents, then that would be a really positive vote. But I think it's more likely to be part of a larger reconciliation proposal that we go forward. And I think the other thing, Leslie, that I think is really wise of you to say is that you don't want to bet against the Speaker of the House, who has made this bill a top priority because it's a top priority of the American people. But I don't see it as an attachment right now. But you never know.
Yeah. And I think we've seen just in the last few days, I know there's been a lot of reporting, understandably, about kind of where the infrastructure bill is going to go and what that means. But at the same time, the Senate Majority Leader has said they're operating on two paths, that they're going to do their best to see if they can have a bipartisan solution, but there will be a reconciliation package. The White House has also said they're following multiple paths. We've just heard what path the House is taking. And so there are vehicles for this that will move. And as the Congresswoman said, the Speaker, I think, has been very clear that it's certainly her intent, plus Chairman Pallone's and Chairman Neal's and Chairman Scott's, to move this forward on those vehicles if need be.
I want to say one other consequence, I think, of the high price of prescription drugs. We're putting out a message when it comes to the vaccine that it's free, because it is hard for a lot of Americans to believe that they're going to be able to afford that. And we have found that some of the hesitation has been because there are too many people who think, how much is this going to cost me? Now, of course, it's free. It's absolutely free. There is no cost. But we've already seen Pfizer go to their investors and shareholders and make the point that that they are planning for a booster, a yearly booster that could cost $150. I mean, they were bragging about the financial outlook for their company because they're going to be able to go beyond the limited time where the vaccines are free to talk about boosters that could be expensive. I mean, there's just no limit to the greed of the pharmaceutical industry and the damage that it's causing to the American people.
Yeah, and of course, as you were saying before, and Richard said, a drug that was a vaccine that was built on the backs of taxpayer money, who did the initial research, that paid for the chunks of the clinical trials and guaranteed hundreds of millions of doses, and provided the science and de-risked de-risked this all the way through. I think we have one more question, but Richard, do you have any other remarks you want to kick into this before we take the last question?
No, I'll wait for the last question then.
Okay. Jason?
Yep. Our last question is going to go to Lauren Klassen from Roll Call. You should be able to speak now.
Hi, thanks for doing this. I was just wondering, Congresswoman, if you expect the Alzheimer's drug to prompt any sort of additions or changes to HR3.
Well, we certainly cannot have the kind of price that has been mentioned by the pharmaceutical company. The scourge of Alzheimer's disease, which certainly doesn't have any preference for various consumers. It affects all communities across the country. You know, to come out with a bill that a pricing that is so exclusionary for so many Americans. And I'm really happy that AARP, who has millions and millions of members, I think it's now 30 million plus members in this country, has a lot to that's AARP, but the Alzheimer's Association, which is such a powerful organization, we simply can't allow that to happen. The gall of charging so much for a drug that is so needed, so anticipated. And so, you know, we're going to have to do something. And of course, negotiation is the real answer to lower the price of drugs for everyone, not just for Medicare beneficiaries.
Thank you. Richard, anything to add?
Yeah, on that last point, I just think the Alzheimer's case highlights a real broken part of our system, which was demonstrated by the CEO's comments suggesting that they didn't really have to do their trials that showed whether it really worked on people's health for 9 years, and that they had a 9-year period where we wouldn't really know whether the thing worked or not, and that the confirmatory trials weren't really a pressing issue while there was a price of $56,000. You know, I think that if we really believe in aligning value and price, we pay well for the drugs that work. We don't pay much for the drugs that don't. And we certainly don't pay for drugs where we don't know the answer.
Yeah.
I think the calculation for the pharmaceutical companies is just to begin with figuring out what kind of audience they need to make the percentage of profit that they want, and that it's priced in at a level $56,000. There will be some people who are desperate enough and rich enough to be able to pay that price and bring in the amount that they have projected in their calculation of what profit is reasonable. The calculation is not about how are we going to be able to deliver this. I don't know if it's a cure exactly, but if, you know, to be able to help people with Alzheimer's and to address such a desperate need in this country. No, it is about how much money can we make, and that's where we're going to price the drug.
Yeah. So, I mean, it's greed and preying on the hopes of millions of families who want every solution they possibly can. And now they're faced with one they can't afford, and we don't even know really if it works. And yet they'll be sitting at home with a loved one in this mess. And it's just really unconscionable for that. I want to thank our speakers. Thank you, Representative Schakowsky and Dr. Frank, and everyone who's joined us for this critical conversation. Thanks again, and everyone have a good day.